What conditions are associated with SIBO? What other, coexisting conditions are associated with SIBO?
Yeah. Yeah, good question. I do see a lot of coexisting conditions with SIBO. So when I diagnose someone with SIBO, it's not unlikely that they have another diagnosis that is associated. And I put them in three different categories. So they might have a root cause that's associated with both the SIBO and then this other condition, or the SIBO has led to a certain condition, or they have a condition that's led to the risk of getting SIBO, right? So those those um, those are the three main categories. And what I'm seeing a lot with SIBO is there's a couple of conditions that may not be very well known, but I see them so much with SIBO, I have to mention them. One of them would be POTS,
Mm,
and it stands for Postural Orthostatic Tachycardic Syndrome. And it's basically an issue with the autonomic system. Patients have a hard time regulating their blood pressure properly. And so when they're standing up from a sitting or laying position, they can get faint or dizzy, their heart rate increases, there can be some fatigue and brain fog associated with it. Another condition I see is something called Mcas, or mast cell activation syndrome. And mast cells are basically these like plentiful immune cells in our body that are responsible for allergic responses. And in this condition, they are just overactive and they're dumping mediators into the bloodstream like histamine. Most patients have
yeah.
heard of histamine, right? Associated with allergies. And I think this is one of the reasons I see a lot of skin issues with SIBO is that these mast cells are overactive and overproducing histamine in an imbalanced way. So those two I see so much along with SIBO. I also see restless leg syndrome quite a bit, which makes sense because iron deficiency is so common, and iron deficiency is one of the main causes of restless legs. So that makes sense.
Yeah.
I see interstitial cystitis quite a bit, which is the inflammation of the bladder, and patients are just going voiding their bladder all the time. I am autoimmune conditions, Hashimoto's. I see quite a bit associated with it, just like you mentioned. Chronic fatigue syndrome, fibromyalgia, those type of clinical manifestations I see a lot of as well. And there's more.